Unlocking resilience, conquering post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, is a debilitating condition affecting millions worldwide. Triggered by exposure to a terrifying event, from combat and natural disasters to serious accidents and assault, PTSD casts a long shadow, disrupting lives and relationships. However, understanding PTSD, its symptoms, and available treatments is the first step towards reclaiming your life and unlocking your incredible resilience. This article will delve into the complexities of PTSD, exploring its causes, symptoms, diagnosis, and effective treatment pathways, offering hope and empowerment to those affected and their loved ones. Understanding the scars of trauma, causes and symptoms of PTSD. PTSD isn't simply getting over it. It's a complex neurological and psychological response to trauma, leaving lasting imprints on the brain. The traumatic event itself is deeply ingrained in the memory, leading to a cascade of symptoms that can significantly impact daily life. These symptoms are typically categorized into four main areas. 1. Intrusive memories, flashbacks, nightmares, and intrusive thoughts related to the traumatic event plague individuals with PTSD. 1. These aren't simply bad dreams, they are vivid, terrifying re-experiencing of the trauma, often accompanied by intense physiological responses like a racing heart and sweating. 2. Avoidance. Individuals with PTSD actively avoid anything that reminds them of the traumatic experience. 2. This can include people, places, objects, activities, or even thoughts and feelings associated with the event. 2. This avoidance can lead to social isolation and withdrawal. 3. Negative alterations in cognition and mood. PTSD often involves persistent negative beliefs about oneself, others, or the world. 3. This can manifest as feelings of guilt, shame, fear, detachment, and persistent negative emotional states. 3. Difficulties concentrating, remembering details, and experiencing a diminished interest in activities once enjoyed are also common. 4. Alterations in arousal and reactivity. Individuals with PTSD may experience heightened arousal and reactivity, even in seemingly safe situations. 4. This can include irritability, anger outbursts, reckless or self-destructive behavior, difficulty sleeping, hypervigilance, being constantly on guard, and exaggerated startle responses. Beyond the symptoms, diagnosing PTSD. A proper diagnosis of PTSD requires a thorough evaluation by a mental health professional. This typically involves a detailed discussion of the traumatic experience, an assessment of the symptoms experienced, and ruling out other potential conditions. The DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, provides specific criteria for diagnosing PTSD, ensuring consistency and accuracy in diagnosis. It's crucial to seek professional help for an accurate diagnosis and a tailored treatment plan. Reclaiming your life. Effective treatments for PTSD. While the journey to recovery can be challenging, effective treatments are available to help individuals manage and overcome PTSD. These treatments aim to reduce the severity of symptoms and improve overall functioning. Commonly used approaches include 1. Psychotherapy. This is often the cornerstone of PTSD treatment. 1. Different types of psychotherapy have proven effective, including 2. Trauma-focused cognitive behavioral therapy, CBT. This therapy helps individuals identify and challenge negative thoughts and beliefs related to the trauma, develop coping mechanisms, and gradually confront trauma-related memories and situations. 3. Eye movement desensitization and reprocessing, EMDR. This therapy uses bilateral stimulation, for example, eye movements, taps, while processing traumatic memories, helping to reduce their emotional intensity. 4. Prolonged exposure therapy, PE. This therapy involves repeated exposure to trauma-related memories and situations in a safe and controlled environment, gradually reducing avoidance and fear responses. 5. Medication. Medication can be used in conjunction with psychotherapy to manage specific symptoms of PTSD. 5. Antidepressants, anti-anxiety medications, and other medications may be prescribed to help address symptoms like depression, anxiety, sleep disturbances, and irritability. 6. Alternative therapies. Some individuals find additional support and relief through alternative therapies such as yoga, meditation, and mindfulness practices. 6. These practices can help manage stress, improve emotional regulation, and promote relaxation. Building support and fostering resilience, the path to healing recovery from PTSD is a journey, not a destination. It requires patience, self-compassion, and a strong support system. Connecting with others who understand what you're going through can make a significant difference. Support groups, peer support networks, and family therapy can provide valuable emotional support and practical strategies. Remember, seeking help is a sign of strength, not weakness.